My name is Justine. I had cancer, so I had a lot of surgery. I didn't have an awful lot of symptoms before I was diagnosed. I had a squamous cell carcinoma of the nasal cavity, which is quite unusual, and it was slow growing. So it was a bit like having permanent hay fever, really. It was just all a bit itchy and a bit sore and congested around there. But because the sinus cavities are quite a big space, it can sort of get to quite a point before it's really going to start bothering you. Eventually sort of had come up on the lymph nodes on my neck, and I had quite a large lump that just kept growing. And eventually they did do a needle biopsy on that, and that came back positive, and then treatment all went on from there. It's difficult to describe unless you actually go through it, particularly and it's very different obviously if it's on your limbs to being on your face. So gravity sort of works in my favour over the course of the day, but you wake up in the morning and it's all very puffy and very swollen, so it changes the way you look, so it doesn't sort of do much for your confidence. In the mornings, like most people, get up, have a cup of tea, and then go, okay, here we go. And it is wash, moisturise, massage, stretches, and that sort of do that fairly first thing in the morning. I've got a little TENS machine that's sort of got pads on it, so I found that's quite good if I put that on sort of on the key areas, because it helps with the circulation, the muscles and things like that. And it's things like then when you go away the weekends, you've got to remember that your bed's going to be flat and you're not going to have all the pillows, and you're not going to have all the bits and pieces necessarily you need to do the maintenance quite so easily. Because it alters you, and obviously I've had a lot of surgery, so it's altered anyway, but it does knock your confidence. So in my case, I've had treatment on both sides. I've had all the lymph nodes taken out. On the right-hand side, when they stitch it up, they use regular stitches, so there are gaps in the scar tissue, so I do get some drainage on the right-hand side, so it's not as bad. On the left-hand side, they stapled it, so the scar is complete and there's no gaps in there. So I do find this side, the left-hand side, can get very full, and I can look very lopsided, and yeah, it doesn't do much for your confidence. Obviously exercise helps. If you go to a gym that's got a power plating, which is the big machines, they're very good because again it's the vibration. But I find on the left hand side there isn't really a whole lot I can do. The right hand side's a lot easier to manage. It really is about maintenance. It's not the end of the world, you do get used to it. It does require some time, some effort. There will be days where you get quite low and quite fed up about having to manage it the whole time, but it's just one of those things you've just got to do the best you can and try and keep your chin up over it, really. You don't get asked a huge amount about it because I think there is a lack of understanding out there, and I think as well, being British, people are terribly polite, aren't they? So I think you have to get to know people quite well before they'll actually possibly start asking you. But then I just explain what it is, what's caused it, and yeah, just try and stay a bit positive about it. The team here are absolutely brilliant. All of the therapists are really good. As I understand it, if you get lymphoedema in your lower limbs, there's slightly less they can do, whereas in the head and neck there's slightly less we can do. And even just the one session, it makes a world of difference. Doesn't matter what you do, it cannot touch what they can do here. The difference is phenomenal, and you feel better, you feel lighter, everything's moving. It's all part of your immune system, isn't it? So like I said, you can feel quite sluggish, but they get everything going in a way that it doesn't matter what you do, you cannot do it yourself. Just stick with it, and it really is moisturising, massaging, keeping your skin soft. Those are probably the best things. Drink plenty of water, try and get some exercise, keep everything moving. But definitely, the moisturising and the massaging is probably the best you can do.